Well, it is just a beautiful day outside. And as I was explaining to this table right here, I could probably go hear anybody talk about anything if they had free cookies. There's not really a topic out there that would prohibit me from going to hear some random guy talk about if you offered me free cookies. So I'm glad we had the free cookies. That's the only way we got them in here was free cookies. But that's okay. But like Tracy said, my name is Dr. Jacob Hodges, and I'm the optometrist up at the Eye Express in Sebring. And it's a pleasure to meet all of you. I was walking around talking to a few of you, and I concur with what Tracy said. Your facility here is just breathtaking, just absolutely gorgeous. And so I know you're all fortunate to be here, and we're fortunate to be here as well. And so today we're going to talk about cataracts. And I'm sure a lot of you have heard the word cataracts before. Some of you might have had cataract surgery before. And so we're going to just briefly talk about cataract surgery, cataracts, what they are, and then talk to you a little bit about Eye Express, and then just a real informal question and answer session. If you have any questions about the eyes, whether it pertains to cataracts or not, then by all means, that's what I'm here for, is to talk to you about your eye health and what you can do to improve your eye health, and just any questions I'll be happy to answer, okay? But a little bit about me. I'm from a small town in north central Florida called Stark, Florida. Really known for not much, and so you're not missing much if you just drive right through it. But known for speed traps, that's what we're known for. I attended the University of Florida. I graduated there in 2007 with my bachelor's degree. That's up in Gainesville, Florida. I attended the Southern College of Optometry for my doctorate degree. That's in Memphis, Tennessee. Graduated there in 2011, and after that, I went back to Gainesville to do my residency at the Veterans Hospital there. And so I've worked in the Veterans Hospital. I've had the privilege to perform many eye exams on veterans, and a very eye-opening experience. Wouldn't trade that year for the world. Just excellent year working with them and helping them with their vision needs. I joined Eye Express in July 2012. It's hard. I was thinking about it on the drive here. I've been here 2 years. This is crazy. Time flies by when you're having fun, I guess. But I'm married, as Tracy said. I'm married to another doctor. We have a child on the way. Our first baby. Thank you. Thank you. So my world is about to just get thrown way upside down, and my bank account's about to get thrown way upside down. So, but that's okay. We're thrilled. We find out in a few weeks if it's a boy or girl. We've already got some names picked out. I'm sure those will change 1,000 times, but we're excited. But technically, we already have 2 kids. And people look at me a little funny, but these are our little guys here. And so this is, I get so excited talking about our little boy. This is Panchito, and this is Pete. And they are best friends, yet bitter enemies. If you pay any attention to him, he goes crazy. If you pay any attention to him, he goes crazy. So I tell people, I've got my left hand on Pete, my right hand on Panchito, and that's still not enough attention. So they drive us crazy, but we wouldn't. I'm sorry? I have no idea. I have no idea. But I'm sure that these guys are not happy about, but that's okay. We love them to death. We got them from some animal shelters when we first moved down here, and we just love them to death. But we're going to talk about what are cataracts. People have heard the word cataract a lot. And a cataract, I tell people, it's really just when the human lens gets cloudy. And there's really no need in complicating it. Just like when your glasses lens gets cloudy, you can't see that great out of them, or with scratches and smudges. The human lens, when it gets cloudy, you can't see that great out of it. And really, it's like, I tell all my patients, it's like looking through a foggy window. You can see things, but you really miss out on a lot of that detail that you once had before you had the cataracts. And so if you look at the picture here, the normal vision without cataracts, you see everything nice and vivid colors, very crisp, very clear. But with the cataract, everything appears washed out. The blacks aren't as black, the whites aren't as white, the colors just aren't as vivid as they once were. And that's one of the greatest things to hear people come back to me after they've had cataract surgery and they say, I never knew colors were so bright. And it's true. That's the big thing after cataract surgery. And so now that we know what cataracts are, we need to talk about what cataracts are not. Cataracts are not Cadillacs. I have a lot of patients tell me that they had cataracts taken out of their eye. I don't know how they fit the cataract in their eye. I don't know. But this cannot fit in the human eye. I mean, maybe it can. I don't know. But a cataract is not a Cadillac. A Cadillac is much nicer than a cataract. But anyway. And so there's a lot of different types of cataracts. I'm just showing you this because this is what the normal lens in the human eye looks like. Very clear, very see-through, very pristine. And as the cataracts progress, you get this little yellowing here, a little denser here, a little yellow there. And that's what the foggy window looks like. That's what the blurriness is when that lens gets yellow. And if you can see here, I know it's a little washed out, but you see the yellowing back here? So that's a cataract on an actual human. And then this is a little bit worse. You see how mucky that is? You can't see anything out of that. That's the cataract. That's essentially causing that vision to be washed out. And when they do cataract surgery, you see how clear this is? They essentially, we'll talk more about this in a minute, but they essentially take that cataract out and they put a clear lens in its place. And we'll talk about that a little bit more. But some signs and symptoms of cataracts are blurry vision. People come and see me all the time and say, I can't see. My vision's blurry. I can't see like I used to. Like we talked about, decreased contrast. Blacks aren't as black. Whites aren't as white. Things are starting to appear yellow. Things are starting to appear gray. Very common symptoms that we hear. Decreased color perception. Reds will start to appear pink. Blues will start to appear washed out. Really just interferes with vision and just what you want to do on a daily basis. Glare. The biggest complaint I hear from people who have cataracts is when they're driving at night. Oncoming headlights cause really big problems. I see some heads shaking out there. Yeah, I see some heads shaking. Other complaints is when I'm in Publix. I'm trying to look at the price tag. The overhead lights cause a lot of glare, a lot of scatter. And so this is big. This is big. And one thing I tell patients who have cataracts but aren't ready to have them taken out yet is, look at getting an anti-reflective coating on your lens. It's basically a coating they put on the lens that cuts down on that glare, cuts down on that light scatter. It just takes a lot of that away from you if you're not quite ready to have the cataracts taken out. And so this just shows you here, this is those oncoming headlights when you don't have an anti-reflective coating on your glasses. And this is when you have an anti-reflective coating on your glasses. So really can bring back some of that usable vision. So what causes cataracts? We know what cataracts are. We know what cataracts are not. So what causes them? Cataracts are caused by UV exposure, sunlight. Unfortunately, well, I can't say that. Fortunately, we live in the sunshine state. They don't call it the sunshine state for nothing. I tell patients all the time, you got to have some type of UV protection, whether it's prescription sunglasses or what we call transitions, where they turn into sunglasses outside. Do something to protect the eye from UV exposure. And UV exposure causes other things besides cataracts. It puts you more at risk for getting macular degeneration and a bunch of other eye problems. We could talk about that at another visit. But poor diet. If you're all like me, you can't say no to a cheeseburger. And so that's my weakness, or just cheeseburgers and fries. I have to fight it on a daily basis. But poor diet can cause cataracts. People who are diabetic are more at risk of getting cataracts. And so you really have to make sure that blood sugar stays nice and stable, nice in that normal range. If you get some spikes and some valleys, that can precipitate a cataract from coming on. Smoking can cause, where's my laser? I think I'm out of laser. Okay, well, smoking can cause cataracts. Cigarette smoke puts you more at risk for getting cataracts, more at risk for getting glaucoma, more at risk for getting macular degeneration. Pretty much everything that could go bad with an eye, smoking raises your risk of getting it. And so smoking causes an increased risk of that in birthdays. Unfortunately, the older you get, the more susceptible you are to having cataracts. It's kind of like an aging change. And so, so there's the sunlight there. There's my arch rival, arch enemy. There's the cigarettes, and then happy birthday. And so what can I do to prevent cataracts? Nothing, kind of. Like we talked about, birthdays will eventually catch up to you to cause those cataracts. But there's some things you can do to slow the growth of those cataracts, slow them down from really affecting you. And sun protection, like we talked about, the prescription sunglasses, the transition lenses that turn into sunglasses. the wraparounds, the blue blockers, as they once were called. A healthy diet. Don't eat cheeseburgers. Eat fruits and vegetables. Studies have shown that lots of green leafy vegetables and dark nuts and berries are very good for the eye. Very good for the eye. And everybody knows carrots. Carrots are very good for the eye as well. Stop smoking. Easier said than done. But stopping smoking really can lower that risk of the cataracts getting worse. And then last, don't stop having birthdays. That's not what we need to do. You have other problems if you stop having birthdays. And so really just take good care of yourself, and those cataracts will slow down how bad they get. Benjamin Franklin, some of you may have heard of this guy. He once said, the only thing certain in life are death and taxes. And this is definitely true here. But I disagree with Benjamin Franklin. I have to say, Benjamin Franklin, as smart as he was the guy that created the bifocal. I have to disagree with him. I would say the only thing certain in life is death, taxes, and cataracts. So they're coming eventually, but we can slow them down. We can really prolong when we need those taken out just by a few lifestyle modifications. So how do we get rid of cataracts? Well, cataract surgery is how we get rid of cataracts. And so if you look here, down here, this is, you can see the little cataract in there. What they essentially do is they make a little incision in the eye, and they go in and they break up the cataract using sound waves, using ultrasound waves. And that cataract gets broken up in a bunch of different pieces. And they suck the cataract pieces out through this little tube. Now granted, this incision is only about 1 or 2 millimeters wide, so it's very, very tight surfaces in there. They put another tube in there and they put an implant back where the cataract was. Now the goal is when they take that cataract out and they put that implant in, the goal is to take your glasses prescription and put that in the implant and put that in the eye, so that you're less dependent on having to wear glasses to see things at a distance. There's some new technology coming out, some exciting technology that they're trying to develop to take a bifocal implant and put that in the eye so you don't have to wear glasses at all. Now with that being said, a lot of patients are still left over with a small prescription, but usually it's a lot less than what their prescription was to begin with. So, there's two types of cataract surgery. There's the old-fashioned manual, and what we mean by that is when we make this incision here, historically it's been done with a hand tool, a little instrument. The surgeon goes in there and makes a little incision. But now the new technology is they're actually making that incision with a laser. And there's pros and cons to each of these, and we'll talk about that in just a minute. So the old way is cheaper. It's a pretty good bit cheaper. It's worked well for a long time. It's worked quite well for a long time, really. Accessibility of surgery, what I mean by this is not everybody has jumped on board with the new laser cataract surgery. It's getting to be that way, but not all of them. And the reason for that is the laser to do that is quite expensive. And so the cataract surgeons have to buy that laser, and not all of them have done that yet. There's a slightly higher risk of complications by doing it with the old way. And it takes a little bit longer to heal after the cataract surgery. And what we mean by that is, I've had a few patients come in that when they've had cataract surgery, they think that their vision is going to be crystal clear the day after. And unfortunately, that's not quite the case. It takes a few weeks for that eye to heal, for that vision to kind of come around. And if you do it with the old manual way, that healing time's a little bit longer. With the new way, you have a lower risk of complications like infections and swelling in the eye after the surgery. You heal faster, and the incision that we showed you is a lot smaller if you do it with a laser, but it's a lot more expensive. And insurance companies are starting to consider paying for the laser to be done, and so that's kind of on the horizon, where we hope at least. And it's just now becoming a standard, and that goes back to the insurance. What we're talking about, the laser cataract surgery is slowly becoming the go-to standard. My prediction is probably 5 to 6 years from now, that's pretty much what everyone's going to be getting, is the laser cataract surgery, because there are some good pros to it. And so we talked about here, they make the incision, whether it's with a hand tool or a laser. and they remove the cataract to put that implant or the new lens in the eye. This makes you, again, less dependent on the glasses for your distance vision afterwards. And these pictures down here, these are all what those implants look like. And so we call these the little legs, and this goes into the eye here. These are all the little legs of the implant. And depending on what surgeon you go to, that kind of cover, he or she will choose what lens to put in there after discussing all of your options with you. So after cataract surgery, you're going to have blurry vision for up to about a month. After about a month, the vision will start coming back around slowly and surely. At the 1 month follow-up, that's when we check for a glasses prescription to see if we can make that vision even better. Because that's our goal, is to make that vision as best as it possibly can be. You are put on some physical restrictions. You can't lift any heavy objects. You can't bend over past the waist. You can't get any tap water in the eye. And there's a few more. You can't do any strenuous activity. And so if you're playing bingo or something and you get bingo, you got to be very cautious. You can't jump up and scream bingo. You got to just be very, you just have to say, I've got bingo. I mean, very, very subtle. Yeah, exactly. Yeah. So they put you on some eye drops a few days before. You're on some eye drops a few weeks afterwards. And the drops they put you on are things like antibiotic drops to prevent an infection and to cut down on the swelling after the cataract surgery. Here at iExpress, though, we're a group of optometrists. And the difference between optometrist and an ophthalmologist is we don't do surgery. So I would love to do your cataract surgery, but you probably wouldn't want me to because I've never done cataract surgery. It would be a new experience for us both. I'm a primary eye care specialist, so I check for things like glasses, contact lenses. I treat infections. I treat inflammations. I follow you for your diabetes in your eye. I treat your glaucoma. I do pretty much everything but surgery. All of the physicians at iExpress are board certified from the Florida Board of Optometry. We're all diplomats of the blah, blah, blah. This is an optional test that you don't have to take as an optometrist, but it pretty much certifies that you have an advanced level of competency. So not all optometrists out there are diplomats, and so if you come to iExpress, you know that you're getting a very good eye exam from a well-qualified physician. We're also active in local and statewide societies. We do meetings like this. We talk to people all the time about eye health and what you can do. And it's because we want to sincerely make sure that you're taking care of your eyes. And we would love to take care of your eyes as well. But we just want to really convey education to the public so that you're more aware of what's going on with your eye health. And I think that's great. I think that the more I can talk to patients and people about what they can do to better their eye, I think that's wonderful. Again, we do not perform cataract surgery, but there are many qualified surgeons that we recommend. We have a handful of surgeons that we recommend. I always tell patients this: it's your eyes and it's your cataracts, and they need to come out. And if you have somebody that you want to go see, if you have a surgeon that your friend went to and that's the surgeon that I want to see, absolutely, we'll sign you up, not a problem. If you don't have a cataract surgeon that you know of, that you want to go see, there's a lot that we do recommend. A lot of surgeons that we do recommend. My only disclaimer is if you have an eye exam and your vision is pretty good and there's a surgeon is starting to talk to you about cataract surgery, be a little wary of premature cataract surgery. If you get the cataracts taken out before they're needed, then the risk doesn't necessarily outweigh the benefit. If you can already see gray, I would just be a little wary of having cataract surgery done a little too early. And on the flip side, cataracts are one of those things that the longer you wait, if an eye doctor, whether it's me or any other eye doctor that you see, starts talking to you and saying, I think it's time to get those cataracts taken out, the longer that you hold off on that, the higher the studies have shown, the higher the risk of complications go. And so just be wary. It's okay to put it off for a little while, but it probably should be taken care of sooner rather than later. A good thing about coming to see us at iExpress is, like we talked about, we don't do cataract surgery, so I'm not trying to sell you something. I'm not trying to push you into getting something that you don't need. There's no kickback that I get. I only care about you and your eye health. And so if you get cataract surgery and you're ready for it, I think that's excellent. and I hope to take care of you after the cataract surgery. If you're not quite ready for it, that's okay. We just kind of monitor it until you're there. These are all the doctors at Eye Express, and this guy right here, I tell you, and then this girl right here, that's my wife. She's wonderful. She's up at our Bartow office in Eye Express, and she does a fantastic job. Not that I'm biased or anything, honey. If you can hear me, you do a great job. But these are all of our doctors, and like I said, we're all certified. We're all trained. I know these guys and girls very, very well, and our only goal is to make sure that your eyes are taken care of.